So human body contains iodine. So there's a little chance of less deficiency, but the blood level is about 8 to 12 micrograms and daily requirement is 150 micrograms. 150 micrograms is the daily requirement for iodine. But where do we get the iodine from? So this is the average requirement for people, 50 micrograms for infants, 90 for children. For adults, we need 150 micrograms and 200 micrograms for pregnant and lactating women. So I would request you to please take this class with the seriousness that it has, because questions will come from this, and if you are not answering the questions in the theory class, you know what is going to happen. You all seen the casualties, so please pay attention to the class. So, what are sources of iodine? Normally, seafood is a major source of iodine. Salt water, seafood, cod liver oil, milk, meat, vegetables, cereals, drinking water. Normal drinking water is a source of iodine. And also food, fresh water also there's iodine sources there, iodized salt. So the biggest source is iodized salt. We'll come to iodized salt a little later. So from this, we get the feeling that what? Only vegetarians will be hypothyroid, isn't it? So because non-vegetarians take seafood, everything else, so the chance that vegetarians will be hypothyroid. But that is not always the case. So these are the common sources of seafood, cod liver oil, small amount in milk, meat, vegetables, and variable in water. But the iodine content of water depends on the iodine content of soil. Okay. So according to soil, you have the iodine content. So the iodine content of soil in Veerbhum will be different from the iodine content of soil in say Midnapur or Sundarbans or Darjeeling. So it is absorbed in the small intestine and remaining the small 30% is utilized, the rest is excreted in the urine. There are also certain substances called goitrogens. Now, what is a goitrogen? Goitrogen is a substance that interferes with the uptake of iodine. Common goitrogens are cabbage, spinach, etc. So they interfere with iodine utilization, and cabbage and cauliflower are the main culprits. So if you take too much of cabbage, too much of cauliflower, maybe you can end up with a thyroid swelling. So these are the radish, cabbage, cauliflower, and this consumption of radish and cabbage and cauliflower, they make it difficult for the body to absorb it in the body. So this is a major, but however, this goitrogen can be inactivated by heating. So if you cook the cabbage well, it can be overcome. So raw cabbage, what we take in salad and all, that should be avoided. So this is the thing you are familiar with in physiology. Are you familiar with this? Are you familiar with this chart? TSH. What does TSH do? What does TSH do? In thyroid, what is the role of TSH? If there is high TSH, what happens? If what in physiology? If there is high TSH, what happens to thyroid levels? TSH बेड़े गेले thyroid की कम में बढ़वे के बोलते कम में so that is a normal procedure. Okay, so this is the mechanism usually. Then above TSH you have thyroid releasing hormone also, which is in the hypothalamus. So this is a complex game. So here you have a major issue. It can affect everybody, not just adults. It can affect small children, babies, everybody. Now here you find that a large number of population, percentage of population suffers from iodine deficiency, more in places like India, Bangladesh, Bhutan, Myanmar, Indonesia, Nepal, Sri Lanka, and it's more severe in Southeast Asia. Now this, if you look at this map, sub-Himalayan belt, the mountain areas, that is Himachal Pradesh, Kashmir, Darjeeling, Hills, those are places where there is more goiter because they don't have access to seawater. So this is what also Chota Nagpur area of Bihar, actually Jharkhand, hilly areas of Madhya Pradesh, Chhattisgarh, parts of Western Ghats. These are all the places where there is goiter, where there was thyroid deficiency earlier on. Okay, but it is improved now. This is a old map. So what happens is basically in thyroid deficiency, we have hypothyroidism, lethargy, poor cold intolerance, bradycardia, myxedema, infertility. So a lot of things are there. So anybody who's got all the symptoms, feeling tiredness, lethargy, bradycardia, please think of thyroid. Fetus in infants, mental retardation, cretinism, then also speech defect, sprint, disorders of gait, growth retardation, and at birth, there can be stillbirth, miscarriage, and so many other things. So, in other words, the thyroid can affect anybody at any time, not just adults. It can affect fetus, it can affect children, it can affect adults also. So, these are the different grades of goiter which we are seeing. Could we have some silence, please? Like class chede devo. Class chede devo naki. So you have hypothyroidism, varying combinations, delayed milestones, speech defects, strabismus, squint. Lot of things are caused by thyroid. Okay, you don't have to go through all this, but remember, hypothyroidism, cretinism, mental retardation, stillbirths, and goiter. These are all common features of hypothyroidism. Okay, so this we talked about already. Abortion, stillbirth, congenital anomalies for the fetus and neonate. For infants in childhood, early childhood, you have cretinism, mental deficiency, squint, short stature. For children and adolescents, we have retarded mental development, goiter again. Then puffiness, dry rare hair. Adult again, sleep. Adult some signs of weight gain, sleepiness, etc. Mental dysfunction is impaired. Somnolence, the person always wants to sleep. Posters of voice, menorrhagia, non-pitting edema. So this is a classical picture of a thyroid swelling. Have you seen a thyroid swelling, by the way? Have you seen thyroid case in surgery? Yes or no? Nobody's seen a case. Surgery class which है? Surgery posting? Have you been to surgery postings? Have you seen a case of thyroid? Yes or no? Jara dekhe se, please lift your hand. Nobody. Okay. So this is how thyroid looks like. Swelling is like this. It will not be that big, slightly smaller, but it will be there. Okay. So this is called iodine deficiency disorders. So these are the general things which there: decreased fertility rate, mental retardation, hypothyroidism, cretinism, and increased infant mortality rate. Now, for this, how to assess your iodine deficiency disorders? You can assess it by the prevalence of goiter, prevalence of cretinism, or by urinary iodine excretion or thyroid function test. Now, one particular thing you will note here is that in there is usually, whenever somebody says he's very tired, very fatigued, putting on weight, feeling sleepy, all these things, or any of this, please think of thyroid. Tell him or her to check for thyroid. That is something which we often miss. Patient bolche, our shorir kharab lagche, our ghum asche, pet baatche, all the things. Bhal lagche na. Think of thyroid. Just get the thyroid test. Okay. So here, the main components of the National IDD Control Program, Iodine Deficiency Disorders. So after the government found that there's a major problem in iodine deficiency, they came up with this National Iodine Deficiency Disorder Problem. They said use iodized salt. Second thing they said was iodine monitoring. Third they said was manpower training, and fourth was mass communication. So what is iodized salt? So iodized salt is the most important thing that is currently being used. So previously, if you wanted to get, maybe your parents were there, you wanted to buy salt, you go to the shop, he'll give you salt, but it was not iodized. So they said that for stopping this on a mass scale, you need to give everybody salt, and that salt should be iodized. So in India, salt is iodized with potassium iodide and 30 parts per million at the production level and 15 parts per million at the consumer level. And this is what the government has done. They have replaced common salt with iodized salt. So everybody gets iodized salt and benefits from it. Okay. So this is the Tata salt. This is iodized salt. Most of you have seen it. You've got a shop to buy something, you would have seen this Tata salt, which is usually there. You also have other things also. You have another brand, Ashirvad iodized salt. So this is the mainstay of iodine deficiency disorders. You give iodized salt. Then the other thing is that you can give intramuscular injection also. This is what the National Institute of Nutrition, Hyderabad, they have recommended. You give iodized salt in safflower or sunflower oil, 1 milliliters. That will give protection for 4 years. The problem is that you cannot give it to every single person. Salt, nobody can live without salt. You take it in some form or other. But this injection you cannot give everybody. That is the problem. But it is recommended for severely endemic population. Suppose there is a lot of hypothyroidism in say a particular block, say Santiniketan for example, then maybe you can do it. But that is the problem. Reaching every victim is very, very difficult. Okay. So it's recommended only for severely endemic population and quick response is needed. Iodized salt, iodized oil. Again, oral, you can give iodized oil orally, but it looks technically simple. The problem is that we don't have many studies on this, how effective it is. There is only limited research on that, and it is costlier than IM oil. So this is again something which is researched. Research is less, but not much. So basically, we are back to iodized salt. Only iodized salt can do it. Then you do iodine monitoring. How do you know that the person is having iodine deficiency? You monitor the iodine by taking examination of the urine and look for it. So iodine excretion detection in urine, detection of iodine in water, soil and food, detection of iodine in salt for quality control. So you have to be sure that the shop which you're buying from iodized salt is not a fake, is not selling different. So periodically the government checks these samples. And another one is neonatal hypothyroidism. That is, when the child is small, the hypothyroidism is there. That is also an indicator of the iodine deficiency problem. Okay. So these are how the iodine is monitored. So you have also manpower training, IEC activity. Now IEC is important. What is IEC? IEC is information, education, and communication. Now when iodized salt was started, a lot of people protested. They said, why is the government doing this? I mean, India is a country where everybody protests for something or other. They said you're doing it to help the big businesses like Tata. Tata's monopoly. But initially there was a lot of protest, but now everybody's taking salt, so no issues. But that is what IEC, information, education, communication, and that also includes creating public awareness. Okay. So this is the same thing I just told you about. You have to have a mass communication, information, education, communication, and that this should create creation of awareness through lectures, etc. Okay. So this is another photograph of thyroid. You can probably might see something like this surgery. It's bigger swelling, almost you can't see anything else in the neck, it goes right up to here. So you have grade 1, grade 2, grade 3, grade 4 thyroid goiter that you can look up in surgery textbooks and you find a difference. And hypothyroidism, there are various degrees of hypothyroidism. How low is the thyroid level? How low is the T3? How low is the T4 levels? Okay. So this, because of this, the government started this program, National Iodine Control Program, in August 1992, and it was renamed as the National Iodine Deficiency Disorder Control Program (NIDDCP). And the basic thing was that you give iodized salt to prevent mental and physical retardation, cretinism, and stillbirths. And the objective was first to do a survey of how bad is the problem. They are doing the surveys in different districts. Then supply of iodized salt in place of common salt. Resurvey after 5 years. Now you have given iodized salt. After 5 years, how is the level of hypothyroidism? Is it the same or has it increased? If it is the same, then it means that either the iodized salt does not work properly, or the thing has not, the medicine is not useful. That is very important to know whether it is there or not. Then again, laboratory monitoring of isolated salt and urine iodine excretion, health education, publicity. Okay. So it has finally been established that iodide salt is the best place to control iodine deficiency disorders, and based on this, the government took a decision to give the entire country by 1994. 1992 it started, and it started in 1986 in April, but by 1992 the entire country was given iodized salt. Okay, so that was something which we have done, and now everywhere you will get only iodized salt. You will not get any other form of salt anywhere else. And they've also banned the consumption or sale of other salts. So if you go to a hotel and you ask for salt, if the guy gives you the other type of salt, he can go to jail, he can be punished. So from 2006, it has been put under the Food Adulteration Act from 17th May 2006. So somebody who's giving you the other salt, non-iodized salt, he can be jailed, he can be put in the fine of up to 10,000 rupees and so on under the Food and Protection Act. So this is more or less regarding your iodine deficiency disorder. Now when you come, let's move on to vitamin deficiencies. You know what are the vitamins? Fat soluble vitamins A, D, E and K, and water solubles are B and C. Now again, let's go to vitamin A. Let me just test your knowledge. What is deficiency of vitamin C? What does it cause? What does deficiency of vitamin C cause? Last bench. What does deficiency of vitamin C cause? Vitamin C deficiency, what does it cause? What disease? No, let them say. Vitamin C, which disease does it cause? Deficiency? Bolo. And vitamin D? Huh? D? Bolo. Somebody in the back, bolo. Somebody behind you. Vitamin D deficiency? And you finish your physiology. Okay. C causes rickets. D, what does D cause? You don't say, let the person behind you say. What does vitamin D deficiency cause? Huh? Dengue. What is it? Vitamin D, what does it cause? Yes, rickets, yeah. So please, that's what I want. Vitamin D causes rickets, deficiency causes it. And vitamin B1, what does it cause? Very well. Okay. So just revision of your physiology classes. Okay. You seem to have forgotten everything. You've gone to third year, you've forgotten first year. Don't forget. Okay. So what does vitamin A do? Vitamin A, it's important for normal vision, night and dim light. And apart from that, it also maintains the integrity of the body, integrity of the structures, which lines intestinal, respiratory and urinary tract as well as skin and eyes. Okay. So vitamin A this is the main thing. The main problem with vitamin A is that it can cause, it's responsible for normal vision. So here you have retinoic acid, retinol. Again, your biochemistry, physiology. I'm trying to repeat, trying to make you remember. Unfortunately, you cannot remember. Excuse me. So they function as steroid hormones, and they are also responsible for functioning for synthesis of glycoproteins. Okay. So, and essential for the maintenance of proper immune system. Now again, what is the sources of vitamin A? These are the common sources of vitamin A: animal sources and plant sources. Among animal sources, you have liver, eggs, butter, cheese, whole milk, fish and meat. You also have fish liver oil is the richest source of vitamin A. Okay, fish liver oil, spinach, amaranth, papaya, mango, pumpkin, and carrots. These are the common things which increase the vitamin A. So these are common things which we often have, and which vitamin A is there. So just look at this picture once again. Carrot is one of the commonest things. You have carrot juice is very good. Then fish and liver. These are the common things for vitamin A deficiency. For vitamin A. Now what happens if vitamin A deficiency is there? Normally, liver has a big capacity for storing vitamin A, but the problem is that a normal person can have vitamin A resources for a long, long time, and for 9 months or more. Free retinol is highly active but toxic, so it is transported by combining it with protein. Okay. So here again is a major problem. We are having a number of cases of vitamin A deficiency, and this is common in preschool children. Okay. Now, what is wrong with preschool children in vitamin A deficiency? And this is the estimate: 250 million worldwide are vitamin A deficient, and 2.5 to 5 lakh vitamin A deficients become blind. Okay. Now, what is the problem with under 5 children? What is the problem with under 5 children regarding to vitamin A? Huh? Anybody? What is the problem with under 5 children? Under 5 children, what is the problem regarding vision? Anything? Under 5 child, below 5 years. What is the problem? Any problem you can say? What is the problem with yes? I think it's the correct. What is under 5 child? What is the problem? Any problem? What is the problem with the under 5 child? Any problem? Huh? The night blindness will come to that. But the problem is that the child cannot express itself. The child cannot say what is the problem. Okay. Until 5 years, mind you, I'm talking about this big problem. Soldi hoche, jor hoche, the child will cry and all. But regarding this vision is subjective. Vision is subjective means only the person who's suffering, he knows about it. You're wearing specs for 10 years, somebody is wearing for 15 years, I'm wearing for 40 years. But that is subjective. So that is, child under 5 years will not be able to say, because the child is not sure. Okay. So the mothers, they are also not sure. So this is a problem with vitamin A deficient. And so you have two aspects. One is regarding the eye, one is extraocular. Extraocular is we have hyperkeratosis and anorexia and growth level. But ocular, this is the more important one. Night blindness, conjunctival xerosis. Xerosis means the skin becomes dry, the eye conjunctiva becomes dry. Without spots, corneal xerosis, keratomalacia, in which the eyeball completely collapses. So first is, it causes night blindness. Now how do you know when the night blindness? How do you know it's night? When suddenly the light goes off, you're trying to pick up your mobile phone. I'm just giving an example. Now, a small child is there, for example. The child suddenly, when the light goes off, the child cannot find its way to the place where the child is living. The child does not know whether the table here, whether the chair there, or something else. But that is a sign of night blindness. But we often ignore it. Okay, that is the first thing. So that occurs due to impairment of dark adaptation. Normally, if you go for a movie hall, suddenly the lights switch off. Gradually, you get adjusted. Your eyes get adjusted to the film. Then, if you want to go to the washroom, you can go in spite of the low lights. You can go because your eyes adapt. But here, there's no dark adaptation. That is why this night blindness is there. Okay, and if vitamin A is not taken, then it becomes worse. Now, this is the night blindness left side, middle versus right side and left side. Now, if you look at this portion center, he is not able to see anything. Okay, whereas left side person is able to see, right side person is able to see. But the person in the center, he is not able to see anything. That is the problem with night vision and with night blindness. Okay, this is a picture from some other place. So, this is the first sign of first sign. Symptom is night blindness. Sign. Sign, what is the difference in sign and symptom? Symptom is what the patient complains of. Sign is what you see. Here, the conjunctiva becomes dry and it appears muddy and wrinkled instead of smooth and shiny. If you look at your friend's eyes or your eyes, you will see it's smooth and shiny, but here it's become dry. And it is additionally described as emerging like sandbanks at a receding tide. So that's how the sandbanks look, and that is how the conjunctival xerosis looks. Okay, so this is how conjunctival xerosis looks. Then you have the second thing, Bitot spots. This again, you may have read in your physiology. You may have seen it in your somewhere in your books. The triangular, pearly white, foamy spots on the bulbar conjunctiva, just with on either side of the cornea, usually bilateral. If it's present, it indicates vitamin deficiency. Can you see that? Can you see that? Last bench, can you see that? What is the color? What is the color of the Bitot spots? What is the color of the Bitot spots you can see from there? Huh? What is the color? What color is it? Bitot spots? देखते बच्चों, show you. Huh? Last bench, can you see? Huh? कि color टा की बोल रहा? That color is white or yellowish white. ठीक है? That is the Bitot spots. This is the Bitot spot. Okay. This one, triangular, pearly, white or yellowish. This is the Bitot spots. Triangular, pearly, foamy spots on bulbar conjunctiva on other side of the cornea. So this is something which is characteristics of Bitot spots. And if you ask the question, Bitot spots is a feature of which vitamin deficiency? The answer is vitamin A. Okay. Then there's corneal xerosis. Again, cornea becomes dry. At this stage, it's very serious. The cornea becomes fully dry and maybe even corneal ulceration. So this is corneal xerosis with corneal ulcer. Right side, you have a corneal scar. So you're having dry cornea with a corneal ulcer on this side. This side, you're having a corneal scar. Then comes keratomalacia, liquefaction of the cornea. It's a medical emergency. The whole eyeball sinks in and it may burst open. Okay. So at that point, complete vision is lost. No question of waiting or anything of sort. So this is how the keratomalacia looks like. At this point, it's a medical emergency, real medical emergency. This cannot be reversed. Okay. So when you talk about xerophthalmia, it refers to all the conditions of vitamin A deficiency, and it's most common in cause of blindness in Southeast Asia, and also it's commoner among children 1 to 3 years, and is often related to weaning. Okay. When the child's breast milk, the mother's breast milk is, the child has passed 6 months, child is given other food, that is the time when this vitamin A deficiency occurs. So, most of the cases of xerophthalmia can be reversed by giving massive doses of vitamin A orally on 2 successive days. 2 lakh units on successive days can be given, or 110 milligram of retinol calmant. So this is up to this you can give all the doses. International units between 6 to 12 months, 1 lakh international units, and about 12 months, 2 lakh units. So this is for severe xerophthalmia. So if the child is below 6 months of age, you give 50,000 units. Between 6 months to 1 year, you give 1 lakh units, and over 1 year, you give 2 lakh units. So how do you prevent and prevention control of vitamin A deficiency? Short term administration of large doses. Medium is fortification of food. So this is what they said. National Institute of Nutrition, Hyderabad, they have recommended that you give a single massive dose of vitamin in oil orally. Less than 12 months, 1 lakh unit. More than 12 months, you give 2 lakh units once every 4 to 6 months. Okay. So every 6 months, you have to give the vitamin A. Then the medium term actions include fortification of food. Just like iodized salt is given, you fortify some food with vitamin A. So what is fortified? Fortified means you're adding vitamin A to certain commonly used food like dalda, vanaspati, margarine or dried skim milk. These are all added with vitamin A, and that is good only if it is consumed by a lot of people. Now for example, skim milk. Only people who are rich, they can afford skim milk. So it won't be a success. But maybe dalda, slightly more. Again, people who are rich only. Ordinary person will not take food in dalda or something. But therefore, it's successful only if the chosen food is consumed in sufficient quantities by groups. Okay. And long-term action is to obviously to promote a good lifestyle, promotion of breastfeeding, consume green leafy vegetables, and improvements in environmental waste health like safe water supply, mineral sanitary nutrients, etc. Now 1970 was the first year that National Program for Blindness was started, and they started vitamin A supplementation. So this is now an integrated part of the National Immunization Schedule. Though vitamin A is not a vaccine. Please remember, vitamin A is not a vaccine, but it is included in the National Immunization Schedule. It covers children up to 5 years of age. So, first dose is given 1 lakh units along with measles vaccine at 9 months. Second dose is given of 2 lakh units after 9 months. Subsequent doses of 2 lakh units every 6 months up to the age of 5 years. So at the age of 5 years, how many units would that child got? At the age of 5 years, how many units would that child have got? Anybody? That bench, last side. That side, last bench. Last bench. At the age of, the child gets first dose in 9 months. Child gets second dose in after 9 months again. And after every year, the child gets every 6 months 2 lakh units. So totally, up to 5 years, how many lakh units would have got? Up to 5 years, how many lakh units would have got? You have 1 lakh in 1 year, second is at 18 months, 3 lakhs, then subsequent doses of 2 lakhs every 6 months till 5 years. So how many more units how many more lakh units would have got? Yeah, 9. Okay. So 2 into every 6 months means 2 plus 4, 2 into 4, 8 and plus these 2. Okay. So actually 10. So that's how the vitamin A is given. You are giving massive dose of vitamin A. Okay. And for 6 children, all children with xerophthalmia should be treated at health facility. You cannot treat xerophthalmia or dryness of health at home. You have to admit the patient. I mean, you have to get the patient treated at the nearest health facility, whether primary health center or the hospital, and they should be given one dose of vitamin A. Also, any child who is suffering from measles, we have measles in a very big way now in USA. Luckily, it's not that much in India. USA, a lot of children have died due to measles now. And all cases of severe malnutrition also should be given one additional dose of vitamin A. So, vitamin A is beneficial for measles, beneficial for diarrhea, and obviously beneficial for night blindness and xerophthalmia. So again, here, how do you assess vitamin A deficiency? By preschool children, clinical and biochemical reactions. Okay, you look for the prevalence of night blindness, xerophthalmia, etc. So the night problem is the night blindness is more than 1%. It's a serious problem. If Bitot spots are more than 0.5%, it's a serious problem. If corneal xerosis is more than 0.01% and corneal ulcer more than 0.5% and serum retinol which is more than 0.5%, these are all warning signs that there is a serious problem. So these are the criteria which is adopted for vitamin A deficiency. So this is the what we need. Adult man needs 600 micrograms of retinol or 4,800 micrograms of beta carotene. Adult woman also needs the same. Pregnancy, obviously, you need more. Lactation, you need even more. Infants need less. 0 to 6 months, you need 350. 6 to 12 months, you need 350, but you need beta carotene more. And 1 to 6 years, again, you need more. So, children are the ones who are affected by vitamin A, but adults need actually more. Okay. Now, this is what happens if the excess of retinol is given. You have the desquamation of skin. The skin starts peeling off. And then there's also enlarged liver, anorexia, vomiting, sleep disorders, and high intakes can color the plasma and skin. So these are all the problems if you take too much of vitamin A. So if you take too much of, say, cod liver oil capsules or vitamin, this is what happens. Now this is, as I told you, this is now introduced to National Immunization Schedule, though it is not a vaccine. Please remember, vitamin A is not a vaccine, but it is introduced in the National Immunization Schedule. Now this is a vitamin A solution. Now remember, this is a dark bottle. Bottle is dark. It's amber colored. It's very sensitive to heat. That's why if you keep it in the heat, the color will fade and it will not be effective. So that's why it's kept in a dark bottle. Okay. Now 100 ml of vitamin A solution. Each ml contains 1 lakh units. Now, and this is how it's given. This is how it's given, vitamin A. You're given in a spoon. Okay. Just look at this. It's given in a spoon. 1 full spoon is 2 lakh units. Half spoon is 1 lakh units. Okay. So full spoon is 2 lakh units. Half spoon is 1 lakh units. So I think with that, I hope you got some idea of vitamin A deficiency and also of iodine deficiency and what is to be done. Iodine deficiency has to be corrected by giving iodized salt, but vitamin A, you have to give vitamin A solution, which is given according as per age. And the problems with vitamin A are night blindness, xerophthalmia, xerosis, corneal xerosis, etc. Iodine deficiency problems are thyroid, enlargement, cretinism, mental retardation. So both these things, you got some idea of this. I hope that things are clear now. That's all. Thank you.